Hi everyone, thanks for joining us today for the Center for Health Policy Research's monthly research seminar. I'm Dylan Roby, I'm the Director of Health Economics and Evaluation Research here. It's my pleasure to introduce Dr. Mark Peterson, who is a professor in public policy as well as political science and law, and I always think that you should also get an appointment in history because he is a wealth of knowledge when it comes to understanding exactly how legislation passed, who wrote different provisions, who plagiarized different provisions, all the necessary things when understanding legislation. So it's a great honor to have him here with us today. Dr. Peterson will be talking a bit about the electorate and how informed they are in health policy issues. I think it's an appropriate talk, especially in the time of health reform, in that we see a lot of polls out there talking about the fact that people don't like certain aspects of the law. But I think Dr. Peterson's work really gets into the drivers of why they might have different perceptions of the law and the public's knowledge about healthcare reform. So let's all welcome Dr. Peterson.
Thank you. Thank you very much. It's great to be back at the seminar. I've always enjoyed being in the audience and a few times up here, and this is always a great group to talk to. What I'm going to be talking about is really building around a paper that Darren DeWitt, who's here with me, who's really the source of all good things in this paper, and we take responsibility for all the weaknesses. This is a paper we submitted to Political Science Journal with hopes that we can penetrate further into the political science discipline with a really robust study of health issues and public opinion on health. Now, the way I want to set this up is we get a lot of data constantly about what the public's thinking about various kinds of health care issues and what we can extrapolate from what we see in these results. For instance, this is probably a chart that you've seen routinely. It's from the Kaiser Family Foundation monthly tracking poll. This is asking people whether they have a favorable or unfavorable view of the Affordable Care Act. And as we all know, since the Affordable Care Act was enacted, it's been roughly a back and forth around kind of an even split. So whether people, well, what the heck is going on in people's thinking about that? And it gets even more complicated when you look at another time series that the Kaiser Family Foundation has, which is a different kind of question. It's not favorable or unfavorable about the law. It's, do you think that the law, as we go forward, ought to be expanded upon? It ought to be kept the way it is? It ought to be replaced with the fictitious Republican alternative, since we don't really know what that is, never was presented formally, or should it be repealed altogether? And here we see actually much more seems to be positive orientation towards the government taking action on health care. 49% saying to expand or keep, 33% saying to repeal or replace, and if you take out the rather significant number who refuse to give a response, it's really more like 60-40. Leads to a very different impression, I think, of what the public, how the public is reacting to healthcare reform. But it's a little hard to reconcile all these things. So we put the two together a little bit. This is the breakdown on the expand all the way to the repeal for the general public, for voters, for those who voted for Obama in November, those who voted for Romney. And here I just want to point out a couple things. One is, just to put those numbers back up there, of the totals, this group that wants to expand on the law, about a fifth of them have an unfavorable view of the ACA. So part of that unfavorable view of the ACA is coming from people who actually don't like it because, I'm extrapolating here, some of them at least probably want to do something more, something different, something more robust. On the other hand, it's a little hard to tease out exactly what they want or who they are. And what they're about. And by the way, there are people on the other side who say they are here repeal, but who are favorable towards the law. So there's a bit of a noise. This is a much bigger number than the one over here who wants to, is favorable towards the law but wants to repeal. But it does suggest there's a lot more going on underneath the surface. And this is a kind of classic example as we work through this. Support is even, for expansion, even more among the non-voters. Take out the people who didn't express opinion, and the non-voters in November, it's really 74-27. Sounds very robust for a government program of some kind. And if you go, here the Obama people, half of them want to expand the law, and among the Romney people, surprisingly, a presidential candidate who ran to say, first day in office, I'm going to repeal the ACA, not actually constitutionally doable, but that was the way he wanted to frame the issue. Even of his supporters, only 38% actually wanted just to repeal it and not replace it. So there's a lot going on here, and part of the problem is we're capturing people's attitudes in response to these particular questions without knowing very much about what's going on underneath and how people think about healthcare issues and think about health issues and why they think about those things. And what we're trying to do in this paper is really explore the underlying factors that are where people think about where health comes from, what affects health, and how that might affect their thoughts on policy issues. This is going back further in time a little bit, but this is a chart that, whereas the Kaiser Family Foundation chart on favorable, unfavorable has been used a lot by the Republican opposition to say, see, people don't like this law, they want to get rid of it, we should repeal it, it's an abomination. This is a chart for those of us who worked on healthcare reform issues over many years. We read to say, see, people want government to do things. This is the classic question asking people, when you think about the healthcare system, do you think the system works pretty well and only needs minor changes? Do you think it needs major changes? Or do you think it needs to be rebuilt from the bottom up? And these questions have been asked by a number of polling agencies since 1982, and established from 82 to 98. What you see is about around 20% overall people think the system needs to be rebuilt entirely. About 50% think the system needs major change. You put the two together and you get the super majority hovering around 75% or so who say the healthcare system is so broken it either needs major change or a fundamental rebuilding from the bottom up. And people certainly who are advocates of healthcare reform and universal coverage plans of various kinds in the 1990s and before would use this kind of chart to say, see, the public really wants us to do something. The problem is we don't know if that's what the chart tells us. We have to dig below the surface. So for instance, we don't know a number of things. We don't know what some people's underlying assumptions are and knowledge about what produces health and the nature of healthcare and what that might mean in terms of the kinds of policy issues that they would actually want to pursue or have government pursue. We don't know when they say major change or rebuilding what that means or in what direction. I remember very vividly Larry Brown at a conference after the failure of the Clinton plan saying we all looked at these data, major change, the public wants major change. It turns out we in the expert community may have a completely different view of what major change is from what the public thinks is major change. The public may think something that's fairly incremental through the lens of the health policy community is actually the major change they're talking about. We also don't know from that chart how change should be accomplished and by whom. We asked, I'm going to explain these surveys in just a moment, but in a 2008 survey, we asked people about this question about the nature of whether it should be minor change, major change, or rebuild. We asked if you believed in change, who do you think should be what would be the best approach to take? And remember, this is in the context of George W. Bush, Republican, having been president for 8 years, and Congress having been Republican for much of that time, and then had turned Democratic after the 2006 election. And we asked standard question, should be the president and Congress agree on a plan, which is kind of the traditional way we think about the federal government taking action on a major issue? Should it be simply the market, the various participants in the marketplace coming to various decisions that would lead to a reformed and improved system? Or should it be some kind of set of collaborations among private players in the system and government actors, what I call the kind of kumbaya approach? If we can just get everybody in the room holding hands and singing together, we can do this all together. And for those who said they thought major change was required, that's a fairly significant category. It turns out they weren't looking to the president and Congress in the context of 2008. About a third said it was the best approach, about a third said it was the worst approach. And overall, fewer than half were favored that approach. Slightly better is actually leaving it to the marketplace and not having government actors take the lead of President and Congress. But the best, of course, is the kumbaya. That's the one where if we can just get all these players to come together and do the right thing, the system will change. Well, this is a very different read from what we used to interpret those data to mean from that chart. It's just further evidence, I think, that we need to explore explore beneath the surface of what's going on. Well, there are two worlds that try to understand the public in various terms. One is my discipline, political science. It's a major part of the work in political science is to understand public opinion, understand the electorate. There are surveys of all kinds going on, and some of them are the most credible and the most sophisticated in their design and capacities. And then, of course, in the health policy world, we have a significant number of surveys being done, and they're done by there are several individuals who do these, of course, but we think most frequently now of the Kaiser Family Foundation and Molly Ann Brody, who's the Vice President for Public Opinion and Media, and of course her often colleague Bob Lendon at the Harvard Public Health School, who for years has been the primary source of much of the ongoing data in health policy research on public opinion. And what we find is, if you look at the political science literature, there are some people who delve into healthcare issues. Some of them delve in a pretty broad way, but I would say the center of gravity is really to have maybe one question about healthcare in some capacity. And so it's a very noisy measure. We have one question trying to tap into what people are thinking about healthcare, whereas on the surveys done by health policy people, of course, tend to ask lots of questions and are much richer in that respect. Neither is particularly good about population health issues and health status issues and what outside of the medical community, medical process actually affects health. Pretty much non-existent in political science surveys, and even within the health politics policy domain are fairly uncommon questions. When it gets to policy interventions, what government should or should not do, there might be one measure in a political science survey, although I mean, to be fair, there are some that are actually much more robust than this. But for the most part, it's a single measure, a pretty noisy measure of what's going on. On the health side, health policy side, we'll get a lot of questions, but they're typically few about health, mostly about healthcare, and very often, like many of the Kaiser Family Foundation questions, about a specific set of bills that are being considered, particular kinds of actions that could be taken, and not necessarily going to the underlying structure of what's in the cognitive process of the public responding to these questions. When it comes to the public's knowledge about health and health status and the origins of health, essentially, as far as I can tell, pretty non-existent in both domains of public surveys. When you look at the variables that are in these surveys for political attitudes and demographic characteristics, of course, political science is relatively few. I'll try to go hand. You may be political party, age, education, some scoring of ideology in some kind, but relatively limited. The bottom line of the political science literature really is, after you control for everything else, it's the party stupid. Political party partisanship is a primary fundamental driver of public attitudes on healthcare issues, although we're going to argue that these are underspecified models. And on the health policy side, it's pretty idiosyncratic. There are not all that many presentations on the health policy side that use quantitative methods to control for various effects simultaneously to really get independent effects. And so there really is not a primary message that comes out of that, although they also at times can tease out that, for instance, party seems to be very important. I should add that Boris Shore is a young political scientist at the Harris School at Chicago, now up at Berkeley for the Robert Wood Johnson Foundation Scholars in Health Policy Research Program. Comes out of a very analytically sophisticated tradition of doing studies of ideology in legislatures. He's taken it with one of his senior advisors, McCarty, to state legislatures, and now he's doing it in public opinion, and he's collaborating with the Kaiser Family Foundation with their data. Molly Ann's very excited to be working with them, but he is using techniques in which he's finding or discovering, and in his view, that it's not party, it's ideology. That we have terrible ideology measures in our surveys, and if you really get to much better measured, what you see is what's really driving opinion on a whole host of issues in healthcare has to do with ideology. So that's the basic bottom line. It's party, it's ideology, and that pretty much explains everything we need to know. It's going to be a short seminar. I'll see you next time. But we're going to dig deeper than that. We have in our survey instruments questions, lots of questions about health care. We have questions about health and population health. We have a whole series of questions that have to do with government interventions, various kinds of government interventions that allow us to create indices on healthcare coverage, health information, health incentives, and health regulation as different kinds of policy interventions. We have questions that are new and unique about the public's knowledge about health and health origins, including a question about what kind of good health services are, whether health status is affected by the individual choices or versus community effects, and a series of questions about the social determinants of health as well as other determinants. And we have, because of the way these surveys were done, at least the two that we had real control over, we have a vast array of political and demographic characteristics in the data set, and we've also included, have access to, developed a set of geographically specific data for each of the respondents in these surveys. And overall, we're able to provide what seemed to be, because we have multiple and apparently very well functioning questions and a capacity to fully specify and test our models, a chance to really get a more robust understanding of the underlying public opinion about health and healthcare and policy approaches to them. Plus, we have an interesting, we have two time periods, 2006 and 2008, and also now February 2013, just a little bit, but it gives us an interesting window on the dynamics here. Our two surveys in 2006 and 2008 were part of this new cooperative enterprise in which political scientists are coming together as teams to go into the field using YouGov polymetrics, online survey technology. These are actually quite vast. The total population of the respondents is on the order of 30 to 40,000, but we each, as each team gets access to 1,000, represent sample of 1,000 people to whom we can ask our particular questions. And I did this as part of the Blue Sky Health Initiative in 2006 and 2008. And then Molly Ann Brody very nicely included two of our questions on the tracking poll in February of 2013 that the Kaiser Family Foundation does, so we have some insight there. I won't go into these details as methodological, just to point out that we do, the data perform very well, and we put everything on a 0-1 scale to make it easy to interpret, and we use OLS regression, and it turns out Darren did a dumpster dive in all the ways in which to test how the data are performing, and everything applies as one would wish with the requirements for OLS to work. We do some load projection for probability estimates, and I'll show those as well. Well, here's the first question. It's really very new. And let me read this to you. We did ask this in both 2006 and 2008, and this is one of the ones that gets on the Kaiser Family Foundation. We asked respondents to, quote, consider the best way to think about healthcare services provided by doctors, nurses, other health professionals, clinics, hospitals, etc. And three options were offered. First, quote, healthcare services are quote unquote private goods that people should buy somewhat like cars and televisions and based on what they can afford. Second, that their basic healthcare services should be available to everyone as a public good, like public education, but people who can afford to should be able to buy more or better care, similar to paying for private schools. Or third, all effective healthcare services should be universally available, provided to everyone as a right of citizenship and based on the services they need. These are the 2006 and 2008 data, and the numbers are an average of the two because this is brand new. We don't know, how much noise is there. This is over a 2-year period. And what we see is that relatively small part of the population actually thinks that healthcare services is a private good, the kind of good that you would expect to be traded in normal ways in the marketplace. The public school model is a pretty significant one, a little over a third, or about a third, in which people think basically people should have access to healthcare like a public school. 85% of students in the United States get educated in public schools, but of course if you can pay for more, you can go into a private school. But almost half, on average, between the 2 years, are talking about healthcare services as a right of citizenship. And frankly, this was a bigger number than I expected to see, and the private good is a lower number than I actually expected to see. Now, what about many years later, 2013, what about a different survey instrument, telephone surveys, random digit dialing instead of the polymetrics online matching cohort sets, and kinds of differences you would expect? Actually, very similar pattern. I can't say whether these are lines producing, or dots producing a line. If so, I wouldn't be surprised after the debates that we've had from 2008 on through to today that there might be more support for a market thinking this is a private good, which we do see here, but generally speaking, it's still pretty much the same contours. And this is, as I say, no one's ever measured things in these terms, and I think this gives a different sense of how people are actually understanding what healthcare services are. We also asked a question that we posed as the community versus individual, we're on our own versus we're in this together, and it was set up in this way. People have different views about what affects their own health and health of their families. Some people believe that health is an individual matter determined by their own preferences, decisions, and actions. We're on our own. Let's say that they are 1 on a 5-point scale. Other people believe that health is a community matter with their own health affected by the health and well-being of others. We're in this together. Let's say they are on 5 on a 5-point scale. On the scale below, please indicate where you would place yourself. Again, the 2006-2008, what we see is relatively few people say that we are on our own. It's all our own decision making. We're not affected by actions of others or what's going on in the community. Somewhat more are at the other extreme. Most are, the low point is of course in the middle. And this is suggesting some understanding that while we do make a lot of personal decisions that affect health, there are other things that also go on that are going to affect our health status and our family's health status. What about the Kaiser family fund tracking poll in 2013 in February? Very similar pattern. Again, different survey instrument, different time period, a little bit of movement more towards that we're on our own, but generally speaking the same dynamic. And so we're getting some confidence here that this is a fairly stable and robust couple of measures of how people think about healthcare services and how they think about health. Now, we also asked people about various things that might affect their health. They're outside of the medical system. We included the medical system as well, but I'm just going to put up the ones that had to do with what you might call the population health kinds of questions. This is the whole list that we had in 2008. The underlined ones are the ones that we had in 2006. We had more space in 2008 and we made use of it, and this is one of the places. And generally speaking, you can see these are things that would fit into the general literature about nutrition, about having opportunities for better nutrition, opportunities for exercise, opportunities to live in a neighborhood where you can go to park, walk to park stores, and so on. One behavioral one in the sense of avoiding things that are risky behaviors that could lead to adverse health consequences. We used only the underlined ones in the subsequent analysis because we wanted to have both years in hand, and it turns out it actually doesn't really matter that much. Even when you put in the whole set, we get very similar results for 2008. And what you find when you just look at the frequencies, the dark blue or dark green ones, excuse me, are the ones that we're going to be using in the analysis, is that when you look at either it being extremely important or important, most people are on board. They understand that these really are significant drivers of their health status. Now they do, in the view I think of the health policy expert community, overestimate the value of their doctor in determining their health and whether they're good primary care providers. So obviously important things, but most of the literature does not suggest that that's the primary driver of health, but that's what people do think. But nonetheless, they do have this what either seems to be a pretty good understanding of population health dynamics, or they got very lucky answering the questions. Okay, but this community health thing, are we on our own, or are we in this together? Very new, kind of asking questions about what are we capturing here? Is it just a matter of people's ideology? Just a new way of asking people about their ideology? Is it just capturing a new way of asking about their party positions? Is it capturing something real and distinct? And so this is an OLS, a regression that is a fairly simple model. We start off with party and ideology, and in this case, party is obviously very significant. Ideology is too, but in a way that we separate out here in an important sense. Unfortunately, this is the story of American politics. This is an index, the racial liberalism index is actually our version in reverse of what's typically called in political science the racial resentment index. Is that right, racial resentment? Yes. which I'm not comfortable with that terminology. But this is a 4-question series, and basically it gets to the point of whether or not African Americans have been held back in some way compared to others, or whether it's just a matter they should be working harder and then they could succeed like just everybody else. And as you can see, people's sense of whether health is a matter of community or not is highly affected by whether or not they have more tolerant views or less tolerant views towards the position of African Americans in society. Race continues to rear its ugly head in this country, and it's just interesting that my sense of community will depend on whether I think have particular racial attitudes about African Americans. Couple down some of the demographics. Turns out the percent urban in the district respondent lives has an impact favorably towards community. For some reason, it looks like being black has a negative effect, controlling for everything else, and we haven't been able to figure that out. That's the most surprising result that we've seen. But then again, one could tease out explanations. I won't try to because I don't have any evidence to support. But knowing the social determinants of health also has a statistically significant effect on whether or not you think health is a community, affected by a community or not. And interestingly, if you're healthy, you tend to think it's not the community, it's me. If I have insurance, I tend to think it's not the community, it's me. And if I'm worried about having insurance, then it's the community and not me. So John Kingdon, many years ago in his dissertation, did a study of candidates for office, and I've forgotten exactly the terminology he had, but it was interesting. Candidates who lost always had an explanation that was about the environment. You know, I ran in a district in which Democrats can't win, or I ran in a district in which certain attitudes prevail that I don't hold. Those who won, I had a great campaign. Just a terrific campaign, did a great job. It's a little bit similar here. If I'm healthy and I have insurance, I think it's really I'm the one who's managed to produce good health in some ways. But that knowledge of social determinants of health does have a positive impact on this. We're obviously capturing something that's different from just ideology and party, and that gives us confidence that we're getting to something that's more robust, a layer or two down in people's attitudes. Interestingly now, this is using Logit, create predictive probabilities for strong Democrats and strong Republicans based on where they are on that community scale of 1 to 5, from we're on our own to we're in this together. Here are the strong Democrats. The big parts of the bars indicate where most of the Democrats are. About a little under 90% of the Democrats are on the community side, so Democrats tend to be there. But what you do see is, as you get closer, as people have opinions that are more about it's the community, not the individual, they shift into it being healthcare is a right and not something like public education. And of course, very few Democrats are in the category of thinking it's a private good like cars and televisions, and even less so as they get more on the community side. Very robust for the Republicans too. Republicans start higher with it being a private good, these strong Republicans, but as they move on the scale, they come down dramatically on that, and they start joining the world of thinking that healthcare is either like public education or it's a right of citizenship. So this variable, this index is actually, or not index, but the scale is moving people, it seems, in a fairly robust way, which will be important in a second. So now here's an OLS regression on our index of whether you support government intervention in health care. So this would include things like insurance expansions and the like. And what we find is, yes, party identification and our not so great ideology scale in the survey are significant in explaining where people are in their support or opposition to government intervention. Some demographics, interestingly, this is really quite an interesting result. Educated Republicans, those who have college education, are more likely to, one, think that healthcare is a private good and not it's like public education or a right of citizenship, and they are more likely to be opposed to government intervention. So there's something about what's happening to the educated part of the Republican population that really is making them more antagonistic towards the notion of healthcare being something government should intervene, whereas for Democrats it does not have that effect at all. If anything, it has a little bit of the opposite effect. For women, women are more likely to be supportive of government intervention in health care, more so for Republican women than Democratic women. And that's what the multiplicative variable there is the intersection of female and party ID is showing. It's mostly among Republican women. So Republican women compared to Republican men are much more supportive of government intervention. And then here the health variables are quite important. The community impact on health, very statistically significant. It's not exclusively among Republicans, but more of an effect among Republicans than among Democrats, in part because Democrats are generally speaking pretty high on these scales. The knowledge about determinants of health, also statistically significant. And that is roughly the same for both Republicans and Democrats in impact. But I want to emphasize the coefficient. Remember, these coefficients are on the same scale. The coefficient for this community health measure is basically in the same range of weight as the party ID coefficient. So to all those political scientists out there who say it's, political party stupid, I say it's political parties, but it's also people's experience about understanding the nature of health, where it comes from, and even knowing some details about what kinds of factors affect one's health status. And when you leave those things out, you are leaving out a big part of the picture. And you really are you have an underspecified model, and you're not sufficiently explaining where people's positions are on healthcare attitudes. These are the Loja probabilities, again, for strong Democrats and strong Republicans, and you can see that this community measure affects both parties, but it really is most dramatic among Republicans, whereas in the public health knowledge, or social determinants of health knowledge, I should say, it's roughly the same impact for both extremes. We also, in addition to the healthcare questions, we asked about population health interventions, series of questions about using information to help people make better choices, series of questions about having incentives to help nudge people into, as Cass Sustain would say, into healthier behaviors and activities, and then also a series of questions about regulatory interventions, such as banning, large sodas in New York City, things of that sort. And what's interesting is, if you look at Democrats, they are very high already on the healthcare, supporting government intervention on healthcare issues. They remain in that same place, roughly, for health information, but they are not as happy about either incentive approaches or regulatory approaches. That's also true of independents, although independents are more happy about information from the government than they are any kind of other intervention. And Republicans follow a very similar pattern and much more happy about information provision than they are about either intervention in healthcare or incentives or regulation. I expected this to be more of a linear result. I expected that the incentives wouldn't be as bad, information would be pretty high, incentives would be somewhere in the middle, and regulation would be pretty low. I didn't expect to see incentives to be as poorly received as regulatory approaches. But even having said that, that's just the overall sample, even having said that, our model that I've showed you essentially in the context of healthcare also applies to these other dimensions as well. And for instance, this is government intervention in healthcare, and this is labeled here public health knowledge, social determinants of health. It applies as well on information policies, applies as well on incentive policies, and applies as well on regulatory policies, but note that it has an even stronger effect among Republicans. You can get Republicans that get pretty close to Democrats the more they agree that these kind of population health activities or opportunities are significant to people's health status. If you look at the role of being insured or uninsured, an uninsured Republican is just like a Democrat on all of these scales. And all these indices, actually. And so it's the old adage about a conservative is a liberal who got mugged. Here we have a healthcare intervention supporter is a Republican who doesn't have insurance. And that's a pretty strong and interesting result. Here's another very interesting thing. In looking at 2006 and 2008, looking at strong Republicans and strong Democrats, we have questions from the two surveys that were done, the Cooperative Congressional Election Survey and the Cooperative Campaign Analysis Project, those 2 different years, asking questions of people that tap into their knowledge about politics, about the political process? Are there names of people? Do they recognize these names and so on? And so you can define people as being low information, high information, or have them on a scale from the least political information to the most political information. Now 2006 was a low intensity, I mean obviously a big election, the Democrats took control of the House again, but it was a fairly low intensity in the Senate, fairly low intensity election in the sense that healthcare wasn't talked about, wasn't on the agenda. It's a midterm election, so it has much less media coverage than a presidential election. And in that election, a poorly informed on politics Republican is as supportive as a Democrat and strong Republican, as supportive as a Democrat of government intervention. When you turn to 2008, where you have, one, a presidential election, high salience election, much media coverage, and an election where healthcare was one of the central driving issues on which the parties were fundamentally divided, and then you see where the poorly politically informed strong Republicans are. They figured out, oh, I'm a Republican. It means I'm against this stuff. And so these create very different opportunities for policymakers who are trying to move on these issues, because depending on what's being triggered in a significant part of the population for these strong Republicans. Let me just say, by way of summarizing, what we're trying to argue here is the inclusion of these measures of how the public thinks about these underlying issues about healthcare. Sorry, I'm just breaking the equipment of the center. Don't worry, take it out of my honorarium. The public understanding of what causes health and health status is pretty essential to really having a full explanation as to where people stand on various forms of government intervention. And an electorate that's more informed about the dynamics of health status is one that's going to be more supportive of government interventions of various kinds. Did I manage to break my own? Okay, well, just go. Oh, you took it.
Escape.
Oh, I see. Yeah, I didn't see I hit that. Sorry. Okay. Our new questions about the nature of healthcare services, the individual versus the community, what determinants of health knowledge, and so on, prove to be pretty forceful and stable over time. We've been getting we have the full data set from the Kaiser Family Foundation in 2012. It is obviously extremely limited for our purposes compared to what we had in 2006 and 2008. But Darren has been trying to remodel our model in the context of the Kaiser Family Foundation data to the extent that we can. And everything that so far has been coming out of that process has really been fairly consistent with everything we found in 2006 and 2008. So again, we're getting a stronger sense of the robustness of these kinds of measures and what's really affecting people's attitudes about health. We also find that a relatively simple multivariate model with party ideology and the health variables and a few additional demographics explains variation across all four types of policy interventions, whether it's health care, information about how to have better health, incentives about how to have better health, or regulatory approaches to moving people to efforts at better health. Frankly, I had thought that party would fall out of that process as we got more into the informational range, for instance. And it is true that Republicans are much more supportive of informational approaches than the other approaches, but party still matters, and ideology still matters. And so it's attenuated, but they remain robust elements of those models. And we find that this interesting effect of levels of political knowledge and the nature of the election campaigns, and here's an interesting twist. If you're thinking, got evidence here that Republicans are responsive to these issues about what is causing health status and how that, and be not more knowledgeable about the population health factors that affect health status. Maybe we can have an education campaign if we really are convinced that the literature from our field is meaningful on these issues. The problem is, when are you most likely to educate a public is during a period of very high salience campaign. That's precisely the time the ideological and partisan divisions get most brightly drawn, and when the least informed Republicans, at least in the political fronts, end up becoming more like their compatriots in the party in terms of health interventions by the government. And just to emphasize, also compared with other types of government policy interventions, everybody, strong Democrats, strong Republicans, and independents are much more antagonistic towards even incentive approaches to improving population health than they are to informational sources. So there is among a large part of the population, there's a kind of inherent antagonism or resistance to being either told what to do or even being incented in some way, instrumental way in what to do. I will stop there and open to questions and discussion. But thank you very much. Dan.
Mark, do you have a sense as to, I mean, I don't think this is going to be in your polling data, but how, if I take, let's say I take a Republican and I tweak all the variables to make that person more like a Democrat, that they actually do something other than answer the poll? In other words, do they vote for a Democrat, or do they change their party registration, or become independent, or do something that actually then directly affects the political process?
It's a very good question, Dan. It's ultimately the instrumental question is how much any of this actually matters in the end. We don't actually have those kinds of opportunities in the survey data, although there are questions in the Common Core of the 2006 and 2008 surveys that have to do with feeling thermometers about various candidates and so on, and it may be worth looking at the extent to which people who are otherwise the same, such as these particular kinds of Republicans, vary in their response to particular candidates that are on the ballot, wherever they happen to be living. So that's something that might be worth exploring, but it's going to be awfully hard to get into anything that's really a meaningful measure of a behavioral response as opposed to an attitudinal.
Nobody asks, there are no poll data where they're asking, how did you vote at the last election or something like that?
Right, well that's why we do have, actually in the 2006 and 2008 have both pre and post-election surveys, and I'm sure that's in there, and we could maybe tease it out. I don't know, Darren, what you think about that.
Yeah, I guess we could look at, they shouldn't have to give a preference like 9 months before the election, and then there would be a follow-up afterwards.
Right.
We could look at that.
Right.
That would be an easy comparison to do.
Right. The problem is, well, the one thing that the polymetrics technology permits that we did not use very effectively here is you can set up experimental design. So you can split the sample and you can treat one part of the sample with a different kind of prompt, and including videos and a variety of other things. We used a really crude one that didn't make much difference, but you could imagine if we were to do this again, to set up a dynamic in the survey itself that allowed us to try to move people by giving them different information to different parts of a randomly distributed sample.
I have a few questions. Just a couple basics about the sample, just to make sure. So the 2006 and 2008 were separate panels? They weren't the same people you were going back to?
Not the same people, no.
Okay, and you said it was a nationally representative sample. Was that geographically spread out, or, I mean, were they concentrated? Because you're talking about politics, I mean, the difference between party, even party identification among the different geographic areas of the country makes a huge difference.
Darren may have an answer to this. My understanding is, in having the initial participation with this, is that these were intended to be nationally representative. They're obviously not going to be representative. You can't go into a 1,000, 1,100 person data set and get regional representation, but it should be nationally representative. So that kind of cross-regional variation ought to be captured in the sample.
Yeah, if you had a lot of Southern Republicans, it makes a difference as opposed to Northern
Right,
Republicans.
and it's a good. I asked someone that very similar question in response to another issue the other day, and in fact I asked Molly that question on Friday about the Kaiser Family Foundation poll in some respects, trying to figure out who some of these people are that have these somewhat odd attitudes.
So the actual question though is, so going back to this one slide that shocked me as much as you said it shocked you, the public's view about the nature of healthcare services, that private goods was a max of 20%
right.
For 2013, which I find very surprising, and that provided as a right was still the largest category. Can we talk about that a little bit more? Just because when you look at what the Frameworks Institute has done, and
Right.
I mean, and I certainly hear this a lot when I hear everybody yelling at me about Obamacare, from both sides, from the left and from the right, because I get it from both, is that they think of it so much as either a private good. From one side, it's all my decisions and I should be able to do this myself, and why are they interfering? And then the other side, I get most often the basic services for all. I don't hear anybody ever telling me they think it's provided as a right. I mean, that's the very minority opinion. I would have expected these to be almost reversed.
I might have as well, although you're not getting a representative reaction. So
I'm not. I'm getting people that really care.
Right, and they're choosing to speak to you and things of that sort.
Self-selection.
If you look at, in the most recent Kaiser family poll, which has got the highest number here, and you look only at Republicans, and you look at college-educated Republicans, it gets to 44%.
Okay.
So that's what you would, but that's part of the change that's happened in the Republican Party, which has become a much more libertarian. The base has become more libertarian than it was 20 years ago, and that's really where you're seeing that drive. And they're the ones who are they're the more activist ones who are the ones to be driving leadership responses and so on. So what the Republicans in Congress are hearing is they're hearing from a significant part of their base saying, "Hey, wait a minute, healthcare, that's not just a market issue. Leave it alone." So that. Knowing those differences makes this a little bit more nuanced overall. Part of it too, the Frameworks Institute, what the Frameworks Institute found, they have this notion, and I use this in talking to people, it's a very good idea that when you are tapping people's opinions, you're tapping into one of potentially many underlying models they have of how the world works. And what Frameworks Institute argues is that the immediate model that people seem to still have for healthcare is a consumer model. And they're buying insurance in the marketplace and so on. And unless something else happens, that's what they tap into. And so the response you're going to get is coming out of that consumer model. If you give them triggers that start leading them to think about a different model that they also have in their head, say about fairness or about the interconnectedness of the healthcare system and various other things, you tap into a different underlying model of how the world works, and that pops up with a different question. It's possible that our questions serve the function of tapping into a different underlying model because people are not typically prompted in these ways. Now, that said, I can also tell you that there are some people who have been working a lot on the healthcare issue who tell me that the Frameworks Institute is absolutely wrong about the consumer model being the one that pops up automatically, but certainly that's been the results of Frank Gilliam and Susan Biles have had in their work. There's no question about that. But maybe we're tapping into getting people to think about things in a different way, just in the process of asking the question.
Maybe it just isn't talked about enough that it should be provided as a right, is what you're saying.
Well, that could be, but in 2000, October of 2000, right before George W. Bush was elected, there was a Gallup poll question that asked, do you think it's the government's responsibility or not the government's responsibility to assure that people have access to affordable health care? 70% said yes. In what was an election, of course, he didn't win the popular vote, but he did win the election, and it was basically a fairly conservative election result overall. In that election setting, that was a pretty, had to fall somewhere over here because the government is taking responsibility to do something to make sure all these folks have access to affordable health care. It's out there. It's out there, yeah.
Just a clarification question. Did you describe the health incentives when you were...
I did. I said index. For instance, put a tax on sugary beverages. Got the list. I'm not sure I brought that list with me. Do you remember, Darren?
So taxes are considered incentives as opposed to regulation.
Well, they are because you can still buy it.
Yeah.
You can still buy the 32-ounce drink. It just will cost you more. Right,
okay.
As opposed to banning. So the same. These were a list of questions that we derived from very nice papers put together by people for the OECD, which is a broad matrix of different kinds of interventions. And so it has to do with raising the prices of things or making it easier. For instance, providing access to. I think providing subsidies to employers, provide wellness programs and various things of that sort. So it's not forcing anybody to do anything. It's just creating different opportunities, either making it less expensive in monetary or time terms versus more expensive in monetary time terms. Yeah.
Yeah, I think this may illustrate a point. I'm a strong customer of Whole Foods, and people I've met don't go to Whole Foods because they think it's run by a bunch of hippies. But actually, the company is owned by a right-winger, as right as you could get.
Right.
But they're very progressive in promoting good health juices. And even though they charge a little more, you know, they're expanding like
Right now,
wild.
in part, I think he has found a market, so he's a successful entrepreneur,
Yeah.
but I also think he personally
Yeah.
wants to have those things available to people. I doubt he wants government to do anything to advance that
He
policy.
hates the FDA.
Yeah, yeah, and the ACA, by the way.
Yeah.
So when you disaggregate by race, say for the 2 million those categories, do you see a similar pattern happening?
We haven't disaggregated by race in part because I think given the sample size, we're going to end up with pretty small numbers in each of these cells. I don't.
1,000 person
Yeah.
sample.
It's going to
It
have.
had, I think, like 50 Latinos, so
This is
we
just
couldn't
fun.
say much.
This is why when you really want to investigate that issue, you oversample those populations. And there's more and more of that being done. Unfortunately, we haven't yet penetrated into that world, so we don't have those kinds of results. Other questions, observations?
So would it be fair to say that, I guess, what you're capturing in, I guess, the big model of community impact on health and support for government intervention is actually more or less some kind of underlying public-mindedness, right? I guess that if I believe that the community has impact on health, or if I'm someone who's very public-minded, I'm probably going to be more likely to believe that, yes, that the community matters when it comes to health. At the same time, I'm probably also going to believe, if I'm very community-minded, that the government's role should be a little bit more interventionist than non-interventionist. So it's like, it's a subset of ideology. So it's kind of unfair to say it's not ideology when in fact it's being driven by a specific sub-component of it.
It's an excellent question, and I will say that the one critique through the period of time in which we've done this work that we have not been able to respond to because we don't have any measures in the survey instrument was from Kevin S. Sterling, who at UC Riverside, who suggested we may be capturing a communitarianism. And if people at heart have a communitarian strain, which is obviously a version of having an ideology, what we're really capturing is that, and is it really distinct from that? And we can't say that it's distinct from that because we don't have any way to break that out. We have taken that community variable and we've done everything conceivable with what we have available to us to try to basically drive its impact down as low as possible. And we just haven't been able to find anything. And now, if we were to go back in the field and do this again, I think we'd try to figure out a way to try to capture, independent of all that, some measure of people's sense of communitarianism. But even there, communitarianism can break both ways on the role of government. We tend to associate being more community-spirited with being more favorable towards government action, but you may actually be more interested in civic action and civic society as opposed to the public sector. And so it's not necessarily going to drive you towards government intervention. At least I'm hypothesizing, given what I know about communitarian political theory. And of course, communitarianism may be a different wrinkle from the community spirit that you were trying to capture, but I think that's the core. We're at 1, I guess that's the witching hour.
So if we don't have any more questions, let's thank Dr. Peterson. Thanks all of you for coming. On May 14th, Dr. Nadi Frat will be